So let's dive right into the management of epiglottitis. How are we going to manage that child who is coming with epiglottitis, is having fever, the child is in respiratory distress, the child is so anxious, having all the 4Ds that we have talked about? First and foremost, we can nebulize with epinephrine for very severe cases. So very severe cases, remember, nebulized racemic epinephrine for severe cases. And epiglottitis is a bacterial infection, so antibiotics are very needed here. We will start with IV and then followed by oral antibiotics. And the child is in pain, has difficulty swallowing, we would give some pain medication. So always pay attention to the pain of your client and give some analgesics. And also we would give antipyretics. Remember, they will come with high fever around 38.9 degrees Celsius. So we need to give some antipyretics. So we can give acetaminophen or we can give ibuprofen. And in some cases, steroids are given. So please remember this, the medical management for epiglottitis, nebulized racemic epinephrine for severe cases, antibiotics because it's a bacterial infection. We can start with IV and follow it with oral. And then we have to take care of the pain. It's very important. Give analgesics. And clients will come with high fever around 38.9 degrees Celsius. So give antipyretics, can be acetaminophen or ibuprofen. And in some cases, corticosteroids are given. So take note. So as part of your key management, I've stressed on this. The positioning is very important. Help your client to be able to breathe well. So place your client upright. They're sitting up and leaning forward just like that tripod position because it helps to open their airway and improve airflow. So in that client with epiglottitis, sitting is rather preferred than forcing your client that you got to lie down. No, they have to have the right position so they can get in air. And we provide the cool humidified oxygen, which aid in their oxygenation, and it helps reduce the edema in the airway. This is very key client teaching. For client teaching, we have to explain the condition, the treatment options, and what to expect. The caregiver would come in very anxious because the child is having a lot of fever, the child is agitated, and you as a safe and clear nurse, you have to calm down the caregiver. So explain the condition to them, let them know that there are treatment options available, and then let them know what to expect. Provide reassurance and emotional support, and explain any procedure that you're going to be doing to them, and encourage them that they should cuddle and comfort the child because the child will be very agitated. And then teach them that it's a bacterial infection and they need to complete the antibiotic regimen that will be given to them after discharge so they can clear the infection. Explain why you are giving them the medications, how they're going to administer them, and then based on the antibiotic being given, explain any expected side effect. And also discuss that the importance of the Haemophilus influenza type B vaccine, and reassure them that recurrence is not common, so they should just be relaxed. The child will be fine.